Good evening and welcome. I'm Roy Blitzer, and our show is Ask Dr. Business. The purpose of our time together is to provide information and insight to help make your work life a little bit better and more exciting. The desired outcome is you'll take the information you hear, perhaps call in and get a nodule of great data, and make your life and your work and your career more satisfying. We are continuing our series on gender-bending jobs. And we're very fortunate this evening to have Pardis Kelly here with us. She's a podiatrist, and we'll talk a little bit about her career and what it's been like practicing as a female in a not male-dominated, but certainly in an industry that may not have as many females as we would think. I want to remind you to please call in. The phone number is 650-856-1491. I also wanted to tell my viewing audience that if you're noticing anything strange, I did have an injury to my wrists. I'm feeling fine. I wish the story would be very exciting and dramatic about saving someone's lives, but it was a pure accident. 6 weeks, I'll be back to normal. I'm not in any pain, and I'm ready to find a little bit about my lovely guest. Tell everybody where you're from, where you grew up, and how you got interested in podiatry.
Well, I was born and raised in Iran. I came to this country in 1988. I went to UC San Diego, and then I went to California College of Pediatric Medicine in San Francisco. I did my surgical residency at VA Hospital in San Francisco, and I did a year of diabetic fellowship. I have been practicing in San Carlos since 1999.
That's fantastic. Now tell me, were you always interested in feet? Were you the kind of person that was always helping? Were you nurturing by nature? Were you interested in this from the get-go?
Well, I really didn't care what field I was in. I always wanted to be a doctor. I remember being a 3-year-old little girl pretending that my brothers were my patients and I would use a pin, try to inject them. So I think this was my calling. I have always been interested in taking care of people. So when opportunity came and I got accepted to podiatry school, I just went for it. Feet or not, didn't care.
Now, tell us a little bit about what life was like as a female studying podiatry when you went to school. The assumption that I had when I started planning for this evening was that there weren't that many women, that you may have been in a minority, and I was wondering what you experienced even as a student back then, if anything.
Well, my class had 125 students, and I believe there were 30 female students. And to make things a little bit more interesting, I was one of the first classmates who got pregnant and had a child.
So you were a groundbreaker.
Yes. So in addition being a female and being a brand new mom, it was a little bit unusual. But I had quite a bit of a support from school, and I was able to, finish with my classmates and continue with my education. But
were there female podiatry instructors? Did you have any positive models?
We did have instructors that they were female, yes, and they were either professors later, or they would come in as guest lecturers. So,
okay,
yes.
So you did see females in the field.
Yes, absolutely.
What about your residency? Because you did study at a time when there weren't as many females in the...
We did have one female podiatrist who would oversee our residency program. Yes, we did.
Okay, good.
But mainly male podiatrists.
It was male dominated.
Yes.
Now, talk a little bit about your practice. Tell our viewers, and I will ask them to please call in with questions. We're here with Pardis Kelly, a podiatrist from San Carlos, actually, but would love to answer any of the questions you might have. The phone number here is 650-856-1491. Now tell us about your practice, more male, more female. Did you experience any kind of prejudice or fun stories that you can tell our viewers about what life is like in, I still think, a fairly male-dominated profession?
Well, my practice is very much a general podiatry. Even though I had my training in surgery, I chose to do general podiatry because I felt that doing surgery just put a lot of burden on my
On your
family.
feet.
On my family life, just because I had small children when
Right.
I started my practice. So going into general podiatry, I get to see all ages. I get to see little ones all the way to 103-year-old patients.
Wow.
And most of my patients are actually female.
Really?
I believe women are the one that they make all the decisions about medical issues, and they are the one that they make their husbands go and have their feet checked. Um, uh, with my first and last name being a bit unusual, most people they have no idea whether I'm a man or a woman. So when they come into the office, they're usually surprised to see me. I don't certainly, fit the last name Kelly. My appearance doesn't. And I do have my husband who works with me and he manages the office. He's usually the person in the front desk. And when people come in, they usually ask him if he's the doctor. And so
That's a great story. So there is a little bit of a disconnect when they come into the office.
just a little bit, just a little bit.
Explain a little bit, if you could, if men take better care of their feet than I keep on thinking of Arnold. Arnold got everyone started on metrosexual sexual men who got manicures and pedicures. I'd never heard of that before. Do more men take care of their feet? Do they come to the podiatrist, or do they have to be forced there by their partners?
I think no, men don't take care of their feet. But they are actually forced by their partners to come in. And my practice is a bit of a hybrid. We provide medical pedicures, and we do see men coming to that part of the practice because they feel safe. That is a private room, and they can get their feet pedicured and their hands manicured. So they feel comfortable as long as they're not in an open space sitting.
Not on University Avenue with everyone watching their
Correct.
feet soak.
Yes, yes. And I think once they're educated about how to take care of their feet, actually, they're very compliant patients. So.
Well, you did, when we were prepping for our show tonight, you did tell a very interesting story about someone who had given you some feedback about asking too many questions, etc. I think that would be a great story to relate to our audience.
So, as a doctor, when you interview a new patient, you have to know about their past medical history, and it is important to know what medications they take. I had this elderly patient who was not very satisfied with the visit because she later on told my front desk that she would never come back to the office because I had asked too many questions and I was being nosy about knowing about her medical history. One thing that people don't realize is that as a podiatrist, we just like any other specialty, we need to understand the person's overall health and well-being in order to be able to solve the problems with their feet. We need to know about their diabetes. We need to know about their health, heart issues, because everything that is happening up here can affect the feet. So.
Good, that's great.
Yeah.
Now, we talked a little bit about the whole concept of podiatry. And when I grew up in Massachusetts, podiatry, I'd never even heard the word. And I thought it was linked to being a chiropractor, which no one thought was a real doctor. It had a quack kind of reputation. Tell me a little bit about whether you think that's changed over the years, how podiatry has developed into a medical specialty that you can be especially proud of. And
So my generation is not really, well, when I started podiatry, I really didn't necessarily see a whole lot of a difference when I went to school compared to now. But I hear it from my own patients, older patients, when they come in and they use the term chiropody.
that was the...
So chiropodists were not necessarily, they didn't have the education that the podiatrists have now. As podiatrists, we are trained to do surgery, we prescribe medication, and so I have not seen much of a difference, but I'm sure the profession itself has evolved over the years, and it wasn't that long ago that podiatrists were called chiropodists.
And you were mentioning that your training, if you're in the hospital in your scrubs, you go to any particular place where they need you, correct? I thought that was an interesting piece.
Yes. So as a podiatrist, when I was doing my residency, we had to go through different rotations, and these rotations were in vascular surgery, they were in internal medicine, emergency room, and you had to perform just like any other intern or resident. They did not say just because you're a podiatrist, you're going to deal with feet. As a podiatry resident, I ended up doing things that I don't do now. I certainly wouldn't give anybody a pelvic exam now, but I had to do it when I was.
We should tell that lady that you're not a chiropodist. That would be great.
Yes.
Speaking of that, I want to remind our audience that we're here with Pardis Kelly. Our show is Ask Dr. Business, and we're talking about gender-bending jobs. Please call in. The number is 650-856-1491. I sort of feel like the shopping network guy every time I do that, but I want to encourage our audience to give a call because I think you have a lot to bring to the topic. Let's focus a little bit about where you think podiatry has gone. Is it much different than when you began? Do you think the technology has improved, or the people are more readily viewing and seeing podiatrists? Because it was something that was not very popular when we were growing up.
I think medicine has become very specialized in general. So I see that colleagues refer patients to podiatrists a little bit quicker and easier.
I think that's
because I think they have the trust in podiatrists. They understand that there is quite a bit of education.
You are a real doctor.
Real doctors, and then technology certainly has affected medicine in general, not just necessarily podiatry. When I did my residency, we weren't required to do 3 years of surgical residency, but now whomever is coming out, they have to do that many years. And I think the problem with that is part of that chiropody that we talked about, that art is getting lost. So we are educating students and they're becoming surgeons, but they're missing out on the chiropody art of podiatry, basically.
Well, since I do have 2 wrists that are in bone recovery, I had asked who you thought your sort of specialty competition, and you mentioned that the orthopedics would be. What would they do differently than you would?
Well, with orthopedists, not every orthopedist surgeon is interested in feet.
Feet, I got it.
And
their hands.
Well, not every orthopedic surgeon is interested in hands. Even within orthopedic community, people have their own niche and interests. I have colleagues that they're interested in just doing shoulders. They're shoulder gals or guys, or they do hips. And there's some orthopedists that they go
knee people.
Knee or foot and ankle.
Interesting. Okay.
Yes, and actually I do have some of those colleagues that I refer my patients to.
We did tease a little bit. Happy Feet is not a competitor. The people that do the feet massage.
No, but I'm sure that they provide quite a bit of a relief to tired feet. So.
Oh, good.
Yeah.
Well, I want to remind everybody that we are here with Pardis Kelly. The phone number is 650-856-1491. Tell me a little bit about, now in hindsight, would you have done anything differently in your career? Would you have taken any more or less courses? What would you have done? Because when we did our stats, there are still only about 15 or 20% female podiatrists in the country. Would you have done anything differently? Courses, work, etc.
I wish in medical school they would teach everybody how about business of medicine, and perhaps a little bit more about how to deal with patient behaviors.
Psychology, perhaps.
Psychology for the doctors, for future doctors, not necessarily, psychology of the patients, because even if you don't know much about psychology, when you are in a room day in, day out, you learn about psychology. You will become very, good at, picking things out. But nobody teaches you how to deal with the
Well,
stress.
the difficult patient or someone who
Absolutely.
is afraid to walk out of the office because their feet don't look good. I think that's an important
Yeah.
issue. I'm fascinated. We have a caller. Stefan, this is Dr. Business. How can we help you? Or Stephanie, excuse me. Hello, hello. Well, that may be a difficult. Well, Stephanie, hang in there. You're gonna make it. Well, Stephanie is there, but we can't hear her. We did a wonderful test before we went on the air, but it may not have been as effective as we would thought. I'm sure that our crew will try to get Stephanie to the phone. But talking a little bit about the psychology, getting back to our original topic, would you think that would you think a female doctor has a harder time handling a tough patient than a male doctor?
No. I think as a female, as a woman, I think we can handle
Probably better.
better. We're not so black and white like male.
Maybe more compassionate,
yes,
more
a little bit more
empathetic.
compassionate. Yes, yes. But if there's a difficult patient, nobody ever teaches you how to deal with them.
No,
You
that
just
would be a
have-
medical school improvement, a little rehearsal.
Absolutely.
Talk to me about advice. Some young woman comes to your office, wants to be a podiatrist. What would you tell her? How would you tell her to prepare? And what would you warn her about?
I would say go into medicine for the love of medicine, or go into podiatry for love of podiatry.
You're saying now that you do need to love feet, even though
You
you
need to
did.
love feet. You need to love feet, and you need to love feet. And go into this knowing that you're going to spend the best years of your life studying when everybody else is partying and having a good time. And so it's really important to realize that point. Because like I said, medicine is changing, and the financial rewards are not necessarily the same
It's
as
no
what,
longer on money.
yes.
Now, would you recommend they shadow someone? Could they go to spend the day with the podiatrist?
Absolutely.
Like the pink ladies at the hospital?
Absolutely. Day or a week, you go and shadow a male podiatrist, you go shadow a female podiatrist, you shadow a surgeon, a podiatrist who does surgery, or maybe not, who's in sports medicine. So you get a feeling for what kind of a field you want to be in.
Okay.
Yeah.
Now, let's say the person says to you, what problems did you have? What would you warn me about? What would you say? Is there anything that didn't turn out the way you thought it would? Let me phrase it that way.
I have to say, medicine with all its challenges has been very good. We have been very blessed. Really, I really don't know anything better.
Okay, well,
So-
we love job-satisfied people. That makes other people feel that they can identify with it as well.
But just like any other job, after a while you need changes, and it doesn't necessarily mean the job is bad. It's just that you have maybe evolved or grown or changed. So
Well, let's talk a little bit about the future. Where do you think podiatry is going, and where do you think you're going to be heading in the future?
I think podiatry is going to be just becoming very surgical. Again, my
Really?
concern is that the
No longer strapping your feet with the...
yes, because I think the insurance companies and just the medical system dictates certain behavior and certain practice, and so because we are training our students to become surgeons, I think it's going to be just like orthopedists. You go in, get your shoulder done. You go to a podiatrist, get your bunion done. So
Interesting. Well, talk a little bit about your future. You had mentioned that you had a brilliant business idea that I'm going to put here for the camera to see. Pardis and her colleague have set up a small business manufacturing a very high quality nail polish, which of course is linked to feet.
Yes. So this whole project came about from me seeing women coming to my office having issues related to pedicures, and we kind of
Like
identified
ingrown nails that weren't done right.
ingrown toenails, toenail fungus, and again, being a woman, a female podiatrist, I had a lot of interest in nails, and so we decided to come up with a nail polish that was what we call 5-free, which was 5-free means that there aren't any harmful chemicals such as.
Are other nail polishes filled with chemicals?
There are some. There are some, and
I think Stephanie is still trying to get through. Thank you guys for.
and we also created this formulation around grapefruit seed extract, which is a very
So it's environmentally healthy.
yes, and
there are a lot of grapefruits around.
Very well known for its antimicrobial property.
Gosh.
Because people do get fungus in nail salons, and it took us 5 years to formulate this.
Wow.
This little bottle that you see there, it took us 5 years, and we are very proud of this product, and we're seeing great results with our patients. And so we hope that this will be the direction for us.
Well, good for
yes.
you. I think it's linked to podiatry. Now, let me ask another question. Do you think a guy would use nail polish on his feet?
I had male patients that they came in with dark nail polish. Actually, nail polish for men is not an as unusual
Really?
thing that you might think.
Well,
I mean, if you think about it, in other cultures, men do paint their faces and
They
they use
do, and-
ornament. And I think it's the Western culture that is nail polish for a man is somewhat unusual. So.
So the future of podiatry will become more surgery. Your future may end up doing, yeah, I think it's called PS Cosmetics?
It's called Dream by PS Cosmeceutical, and it's called PS Polish.
PS Polish. Okay,
yes.
we'll put that so people, if they're
Yes.
they're interested, will look more into it. I think we have another caller. Is that correct? Okay, Stephanie doesn't seem Stephanie gave up.
Okay.
But I will remind people that the phone number is 650-856-1491, and we'll give it a shot just in case someone wants to get through. Okay, we've talked about advice. We've talked about what you might do differently. Tell me a little bit about what coursework you would do differently. You mentioned the need for business. Would you have taken more of business courses? What would you have wanted to include?
As a private practitioner
Yes.
and running a small business, when I entered this, I had no idea how to run my business.
Really?
So it was by trial and error and learning and falling and picking
I
myself
think
up.
a good class in business would be good. Accounting, maybe?
Accounting would be good, yes. Although, we outsource everything, but it's important to know.
We have a call. This is Dr. Business. How can I help you?
Okay, we've talked about advice, we've talked about what you might do differently. Tell me a little bit about what coursework you would do differently. You mentioned the need for business.
What I wouldn't do, I'm unfortunately unable to. There was a question about something you wouldn't do, which I think would be a great question if someone could. I'm awfully sorry, but that's one of the disadvantages of live TV. We have no control over the technological difficulties. But if someone could even bring the question in to someone in the crew, we could answer it even if we might not be able to hear.
Okay.
They may be able to hear inside. If they bring the question in, perhaps we can answer that. Okay, so we talked a little bit about, in the summary phase, the advice you give, the classes you take. You were very forthcoming about mentioning you didn't have any problems or you wouldn't have done anything differently. What about balance of life? Many physicians lately don't want to be in private practice because of the hours and the long time that they spend together. Did you ever think of joining a group? Are there podiatry groups?
There are podiatry groups. There are big organizations that they hire. However, I was never interested in joining one. Even though we say the buck